Hi there. Welcome to the 2022 Fall Fair Season Cashier Supervisor Training Presentation. We're going to walk through a few different things today, starting with what's new this year, and then the Cashier Supervisor job description, the cashier station setup and what that looks like, the procedures for the cashiers, add-ons and refunds, the reconciliation, and then a Square Terminal walkthrough for the credit card transactions. All right, what's new this year? Masks are required for everyone at the fairs, participants, staff, and volunteers. So bring yours or they will have some provided. We are offering COVID vaccines at most fairs, free of charge. And if anybody's coming just for the COVID shot, they don't need to fill out a registration form. They can just go straight to the vaccination area. For the fair, we strongly recommend appointments, but they're not required. There are package discounts available only for online purchasing. And then new this year, Square payment terminals are used for credit cards. So just to mention about the discounts that are available, the packages are available online only. The baseline health and the essential health packages offer a really great discount for blood chemistry and A1C, and then the essential health adds the vitamin D for the $20 off. There's also a 20% discount for all volunteers, and you can use that discount whether you register online or in person at the fair. All right, the job description for the cashier supervisor. You're going to work with your site coordinator to recruit volunteer cashiers. You'll supervise and train the volunteer cashiers. You'll issue refunds at the fair and also add-ons, which we'll talk about later. You're responsible for reconciling all the receipts and the money and the forms at the end of the fair, and then return everything back to the 365 Health office. At the cashier station, you'll have a group of people. First of all, yourself, the cashier supervisor, and then you'll have 2 to 4 cashier volunteers. And these people are the ones that make sure the forms are complete, they take the payment, and they're going to greet the participants and direct them where to go to get to the lab after they've made their payment. The reconcilers are going to be 1 or 2 people, including yourself, and you're going to have a separate area set up in order to start tallying the forms and reconciling the sales and the money. We'll go into more detail about that in a little bit as well. So before the fair, you want to be in touch with your site coordinator at least a couple weeks ahead of time. Make sure you have each other's contact information. And a new thing this year, we need to make sure there is Wi-Fi connectivity available at the location of the fair. Before the fair, also, you're going to be in touch with your cashier volunteers. The number of volunteers that you need depends on the size of the fair, and you're going to have that information in your cashier paperwork packet that you'll receive after training or in the mail. So ask friends and relatives to help. Ask your site coordinator for help too, and volunteer recruiting your volunteers. Normally the first hour and a half of the fair are the busiest, and there might be long lines. As things free up, you might have an additional person who can help elsewhere once the line dies down, or have an additional person for the first couple of hours to help with just directing the line between form check and the cashier and making sure people know where they're going. What you need to bring to the fair, there are some things that you're required to bring that are not provided. First of all, starter cash. We recommend about $150, and that's going to be yours. You can ask if it's a hardship. You can ask the site coordinator if they can provide that. $150. Obviously, you take it back out at the end of the fair before you start counting the money. And then you'll need a box to hold the cash and receipts and checks. And this could be a shoe box or a pencil box, or if you have an actual cash box from the location that you're going to be holding your fair. A lot of churches and schools have a cash box that you might be able to borrow. And then a box for the participant forms. You want to keep these forms in order. Some people keep them in order by the form number up at the top. You can also keep them in alphabetic order if you find that that's easier for sorting through when you're doing the reconciliation. Okay, extension cords for credit card terminals. You may need these if you are going to be charging them at the site the night before. This is where you need to, we'll talk about this in more detail, but if you're able to, the night before the fair or whenever they do the setup, have the terminals there, plug them in, turn them on, get them on the network, and we'll talk about that more. But if you can, do that the night before. And if you do that, then you don't need an extension cord because if the devices are charged, they'll last all day. Okay, you may need to bring some office supplies if you use paper clips or sticky notes or whatever you need to make your reconciliation easier and more organized. The paperwork packet that I mentioned, that'll be provided to you either if you're doing in-person training or it'll be mailed to you or you'll be able to pick it up at the office here. We provide forms, pens, small calculators, check stamps, and some signs to put on your table. Bring your own calculator if it's bigger than those if you want. You can use an adding machine or calculator or your phone or your tablet, but make sure you have a calculator available. And then you're going to make sure that the cashier volunteers are trained. Even cashiers who are returning from previous years need a refresher course, and especially this year because of the new credit card terminals. There is a cashier training presentation that is available, and you can check with your site coordinator or one of the liaisons at the 365 Health office to get access to that. It will be on our website. And then also walk through the square instructions with the cashiers and also the procedures before the start of the fair. All right, on the day of the fair, then try to arrive at least an hour before while everybody's setting up. That gives you time to make sure you know where everything is at and you've got your table set up and your reconciliation area. And the cashiers should arrive at least a half an hour before to help out and get organized and get familiarized with the area. So during the day, you're going to just reinforce the training with the cashiers, supervise them, make sure that they're following the instructions correctly. There will be a little card with a quick reference of the procedures for accepting a payment and also for using the credit card machines. And then just assist with anything that comes up that one of the cashiers might need your help. You're going to be the one who assists participants who need refunds and add-ons. I ask that the cashier supervisors do that and not the cashiers, because there's a couple extra steps there that we'll go through. And then, of course, you're going to reconcile the forms and the money and balance everything out at the end of the day. So the cashier station, this is a picture of a cashier station from our spring fairs. And you could see they've got their signs hung up behind the tables. So people walking up, this is an outside cashier station. So people walking up from the street can see exactly where they need to go first. If you have signs on the front of your tables, people won't be able to see them from a distance, especially if somebody's standing in front of that sign. So try to have your signs visible from a distance. And make sure you have enough room for all of your cashiers and a little extra room for your reconciliation area if you're going to be reconciling during the fair. All right, so that reconciliation area is going to be either a separate table or an area sort of away from the cashiers, possibly just at one end of the table or at a separate table. You want to keep things separate while you're tallying during the fair. You want to move the forms and the checks and the payments to this separate area to keep track of what you've already tallied. So you're going to just start recording the participant forms and the payment amounts and types using either the Excel spreadsheet or the paper reconciliation. Right? If you're using the Excel spreadsheet, it's easy if you've got enough cashiers to just do that as the fair goes on, and just start tallying as soon as people start paying. That allows you to stay on top of it and stay organized and finish up quickly after the fair. If there isn't time to do it while everybody's packing up the fair and heading home, feel free to take it home and do it in the comfort of your home or your office where it's quiet and no distractions, and you can take your time and make sure that you balance everything right. All right, just some information about online registration. The advantages are, like we said, there's some discounts available. People can have an online dashboard where they can see their results on the website. They get to pay with a credit card in advance. They print their forms and bring them with them to the fair. So they really will bypass the cashier line altogether in case they need additional blood screenings or refunds. And then the right upper corner is the number, the participant number that you're going to use to record add-ons and refunds. So just take note of where that number is. This is a participant form for walk-in registrations. When they get to the cashier station, they should have all of the yellow boxes filled out and the yellow signature line at the bottom. So they've got two places to stop before they get to the cashier. They're going to start at the registration desk where they're going to get this form, and then they're going to sit and fill it out. If they have questions about what test to purchase, there will be a medical volunteer to help them with those decisions. And then from there, they will go to the form check volunteer to make sure that their form is filled out correctly. Once that's done, they will come to the cashier station. So this is a three-part form. The top page that's white is for the lab. The second page that has green typing on it, has green letters. That is your copy that you'll keep when they pay. You'll tear that copy out. And then the yellow copy is the bottom copy, and that's their receipt. Okay, if the witness didn't sign next to the yellow signature line, you can sign that as the witness. Normally that would happen at the form check table. All right, here, this is the box where people are going to be choosing which tests they're going to purchase. They're going to put an X next to those. And just a reminder that we are not qualified to give people advice on what tests to purchase. It's not appropriate for us to advise people on anything. If they have questions, they can go back to the medical person that's near the registration table. You will have a list of the tests available and the description of what each of them does or what each of them tests, and you can provide that information to people asking, as long as it's just the information, the data that's right on the paper on the paper list. We used to have a test called blood chemistry, and now it's called ChemScreen. So if you're familiar with the blood chemistry screening that we had in the past, it's the same thing, it's just called ChemScreen. All right, so when they come to you, they should have that left column filled out, the X's, to select what test they're going to purchase. So you're going to make sure that those X's are marked clearly. And then on number 2 there in the total column, write the price for each of the tests that they're purchasing. If it's a volunteer, you're going to write that 20% discount price there. Okay, and then if they haven't written in a donation, ask them for a donation. Write that amount there next to the red box and the arrow. And then number 4, total everything in that column. All right, number 5, then mark the payment method. If they're using more than one payment method, mark both. Under this area, there's room for you to write a check number if you want to write a check number, or if you want to write paid on there so it's clear that they have already paid for their test. I think that's a good idea. Some people have their cashiers put their initials so they can go back and see who did the transaction in case there are any questions. So those things are up to you, however it works best for you. On the back of the yellow copy of the form is this form on here that is for the optional screenings. So this just is an example so that you know what it is. There's nothing that you need to do with this, but maybe explain it to the people if they ask. So they take this form with them. It's the back copy of their receipt. They take it with them to the optional screenings that are available, such as vision or a dental exam or diabetes risk assessment, those types of things. There's a place there where our screeners can put some information there. If their screening checks out to be normal, they'll mark that. If it needs further evaluation from their doctor, they'll mark that. And then the participant can take this to their doctor and discuss the issues that might be concerning to them. So for volunteers, they use the same registration form. Like I said, you're going to write the discounted prices in the total column. And this is the 20% discount prices, so you can see what they are. And you'll have a copy of this list at the cashier station so that you can, you don't have to calculate those prices. They're right there for you. It's helpful to write volunteer at the top of the form so that when you're tallying forms, you can pull those out quickly. You can identify which ones are volunteers because obviously those prices are going to be different and you want to make sure that you account for those correctly. All right, it pays to ask for donations. We ask you to ask everybody who comes through your line for a donation, and this provides free screenings for people who can't afford them. In the spring, our cashiers brought in over 8,500 in donations, so it really is significant. It really makes a difference, and it's really helpful to the company, the organization, if you can get some donations to pay to allow other people to have free and low-cost screenings. All right, accepting payments, a lot of this is pretty obvious. With cash, you're going to count it very carefully. Always count it twice. And then if you have a reconciliation area, you can move that once you start to receive a lot of larger bills. You want to remove that and keep it secure. For checks, if people don't fill in the payee line, you have a stamp to fill that in. And then you'll have a stamp to endorse the back. You'll want to write the participant number on the memo line. Make sure that the name on the check matches the name on the registration form, or write that down somewhere. Write the participant numbers on the check or write the check name on the form somewhere. You just need to be able to match the check back to the form, however you need to do that. Some people will paperclip the checks to the forms, and that's great if you want to do that for your reconciliation. It's easier when you're recording things to keep things matched. Please don't use staples, because if you use staples, we need to take them back out, and that's a little more time consuming. For credit cards, we now accept all 4 of the major credit cards. Debit or credit cards, they're handled the same. Our systems don't distinguish between debit and credit cards. Google Pay and Apple Pay are also available on the Square terminals, and those are the apps that people have on their phone to pay with a credit card using their phone. And like I said, you'll have an instructions card that you need to keep handy just in case. And then when you print our copy of the receipt, write their name on it. So again, you can match it back to their form. A lot of times people that write checks or use credit cards are paying for more than one person. So you need to make sure that you make a note somewhere that that credit card represents 3 transactions or however many transactions they're actually paying for. Make sure you can match it back to the forms. All right, vouchers are for blood chemistry or the chem screen test that we talked about. It's a $45 value, and they are distributed by the site coordinator before the fair or at the fair to allow people to get this blood screen for free. So we say it's a $45 value, so people can actually apply it to a different screening of equal or lesser value. If they want to purchase a screen test that's more expensive, they will pay the difference. Okay, if they purchase something that's of less value than the 45, we're not going to give them the difference back. It doesn't have a cash value. Okay, make sure to mark the registration form that the payment method is voucher, and you'll just put it in the cash box with the other money. People may use this in addition to another payment method for their entire purchase. So be sure to mark on the form both payment methods if they do that. Make sure you write in the bottom left corner the site number or name and the participant name or number. Again, you want to be able to match it back to the form. And for the staff back at the office, we need to make sure that we can tie this back to your fare. So that information is very important there. Okay, add-ons. I mentioned earlier that if somebody online or even somebody who's already paid wants to add additional tests, they will come back to the cashier table and they will request that. The cashiers should notify you, the cashier supervisor, so that you can handle these transactions. What you're going to do then is there's a form. So in addition to writing on the participants form, you're going to use this spreadsheet. It's a paper form that you'll have in your cashier packet. And you're going to fill it out. Use 1 line per person. You're going to write their name and their form number on the left there, and then you're going to write in the boxes here which tests they're adding on, what they're purchasing, how they paid, and the total that they paid. Okay, if it's a volunteer, you're going to write in the volunteer prices. And then on the participant form, you're going to mark the additional tests and note on there that they were paid. This form is a 2-copy carbonless form. The top copy is white and the bottom copy is yellow. At the end of the fair, you're going to tear the white copy off the top and give it to the lab supervisor. So you need to know where the lab is. You need to go to the lab and ask for the lab supervisor and make sure you hand these forms directly to them. You're going to keep the yellow copy because you need that for your reconciliation. And if there were none, just write none in large block letters across the page. You still need to give it to the lab supervisor even if there were no add-ons. Okay? And again, make sure everything is documented well so that when you're doing your reconciliation, you'll be able to track down where those additional tests came from so that everything balances. For refunds, we will provide refunds to people who ask for them. There a lot of times, few times, there may be somebody who was unable to have their blood drawn, or they changed their mind, or they have to leave before they can have their blood drawn, or whatever the reason is. We can give a refund. Again, there's a form, the refund form I'll show you. But there's a couple of different things that we have to handle refunds differently than just add-ons. So for day of the fair registrants who need a refund, say they couldn't have their blood drawn, if they paid by cash, we're going to give them, I'm sorry, if they paid by check, we're going to give them their check back. And then if they didn't get a refund on everything they purchased, have them write a new check for the balance. Don't give cash out as a refund for a check or a credit card. Only give cash out if they paid cash. If they paid by credit card, we'll do a refund on the credit card terminal if they were a walk-in participant. Online registrants, if they need a refund, you'll mark that on the refund form. Those refunds need to be done back at the office by the accountant. So make sure that those are documented very well. And just explain to the participant that their refund will be processed within 72 hours to give us time to get those refunds done online. All right, this is what the refund form looks like. And this one is split into two sections. So I've got just two short clips of the form so you can see what they look like. There's a separate section for walk-ins and online. It's used similarly to the add-on form. You're going to write in their name and number, write the amount of the test that they're refunding, and then how you're refunding it back, cash, check, or credit card, and the amount. The online registrations, you're going to log these guys, you're going to record them here, but you're not going to do anything with them. It's just going to be on this form. So those are not considered when you're doing your reconciliation. Okay, those are just for us at the office to do those refunds. Again, at the end of the fair, make sure you give the white copy to the lab supervisor and keep the yellow copy. And if there were none, write none on it and give it to the lab supervisor. Okay, now that the fair is done or your cashiers are handling it and you can start reconciling, it's your job to make sure that the amount of money brought in equals what was recorded on the participant forms as having been purchased. So during the fair, you want to make sure you don't leave anything unattended. Make sure the money is secure at all times and somebody is sitting there with an eye on it. Don't leave your tables vacant. These things will help you stay organized while you're doing your reconciliation or in advance of your reconciliation. Keep your cash sorted by denomination and also sort your checks and your credit cards by amount. Makes it a lot easier to record them if they're sorted right. If you're going to use the Excel spreadsheet, you can start recording those things during the fair. If you have enough room and enough people and you want to start reconciling with the paper method at the fair, feel free to do that. Make sure you have enough room to keep things separate and to keep things organized. All right, step one, you're going to start tallying the participant forms. So with a paper reconciliation, you're going to have one person with the tally form and one person with the registration forms. And somebody is going to read out loud the test that somebody purchased, and the other person will mark those on the tally sheets. As you're tallying them, be sure to put a check mark on the form when it's tallied so that it doesn't get tallied twice. On the Excel spreadsheet during the fair, if the cashiers pass you the forms and the checks and the credit card receipts, you can start entering them in the spreadsheet as the fair goes on so that you're organized and you've got things done as quickly as possible. All right, this is what the paper tally looks like. You've got one for walk-ins and one for volunteers. So you'll keep them separate because when you calculate the amount of money, you need to keep those prices separately. So as you tally each form, you're just going to make a tick mark under the type of test that they purchased. You're only counting the tests. There is no money involved here. You're only doing a tally of the actual tests. Right? Remember to also tally the add-ons and refunds and those columns on the right. And then total each row at the end of the fair when you're done tallying all of these. If you look through this, you'll notice that a couple of these were tallied incorrectly or added incorrectly. So always double check. At the bottom is where you'll just record donations so that you have a total at the end of the day. And again, the volunteer tally looks exactly like this. Make sure you keep them separate, but you're gonna tally everything like that for the volunteers on that form. All right, then the money tallies. Once you've tallied all the forms, you're going to count the cash. And then you're going to, for each denomination, you're going to write in the quantity of those bills that you received. Again, count everything carefully, have somebody double check and count again, just in case. It'll save you time later if you have to go back and hunt down a problem. If somebody has double counted everything, then you'll be sure that you have the right amounts there. And then the vouchers at the bottom, you're going to just record how many and then multiply that out for the total amount. Always use a calculator, please. Don't try to do the math in your head. It just will help reduce the number of errors and the amount of time you need to spend going back and redoing things. For checks and credit cards, the tallies look very similar, but they're separate. Each one's separate. So for the credit cards, this one shows the credit cards. This is why you want to keep them sorted by amount. You're going to write the receipt amount in the first column and then the number of receipts of that amount that you have, and then multiply out the total, and that'll bring you to your total at the bottom. This saves you room on the tally sheet so that you're not recording every single credit card receipt. It's just a way to consolidate things, make it easier to do the math and to count. Again, use a calculator. And then do the same for the checks. All right, step 3, after the fair. After the fair, you're just going to finish doing what you were doing or start the tallying. Make sure you've tallied all the tests and the money. And if you're doing the Excel reconciliation, enter the information on the participant forms. And again, please place a check mark on each form to make sure you don't double count it. For the paper reconciliation, you're going to transfer the totals from the 2 test tallies to the reconciliation form. Total the tests and verify that they match the tally sheets. And then add together the walk-ins and volunteers and transfer the money totals from the tally sheets. Subtract out the donations from the money, and then the total tests should equal the total money received. So let's walk through that on the form. You've got 2 sides of this form, the walk-ins on the left and the volunteers on the right. And you're just going to record in the units column, just copy those straight from the tally sheet. How many of each test did you sell? And then do the math out to the side to that 3rd column, total screenings, and total in the green box how much money you sold, how much you sold in tests to walk-ins. Same on the right for the volunteers. If you add those 2 boxes together, A and B, that's your total for tests that were purchased. On the bottom of the form, you're going to just copy the numbers from your money tallies, the amount of cash, vouchers, checks, and credit cards. Remember to subtract the donations total And that's the money that you received for tests. So that number should match the box above, the total test, box A plus box B. If those two numbers match, then you are balanced. If not, then you're going to go back and double check how everything was tallied. And that may require tallying each type of test, tallying each form, recounting the money, retallying the receipts until you track down where the problem is. All right, if it doesn't balance, like I said, go back and recount your cash and checks. Match the credit card receipts to the checks. And this time, clip everything with a paper clip. It just makes it more organized when you have to go back, make sure everything is matching. Ask someone else to recheck your work. And then if you don't have time at the site before everything is cleaned up and closed up, take it home and start over. Okay. This is the spreadsheet method. So what happens is we email you the Microsoft Excel spreadsheet. So you won't need a network on your laptop at the fair. You're going to have it downloaded. Read the instructions tab very carefully. That's the first tab. And then if you follow the instructions, everything should go very smoothly. Once you're balanced, you can email the spreadsheet back to the accountant after the fair. It's not required for cashier supervisors to use this spreadsheet, but it's highly recommended. It makes things so much easier for you to track down discrepancies. Eventually, it will be required, but there are people who don't use Excel, and there are people who just feel strongly about just doing it on paper. And that's the way it's traditionally been done. So you'll see at the bottom the tabs that are included in this spreadsheet. The instructions tab is very important. And then the participant form details and the volunteer form details. Add-ons and refunds. They look just like the forms that you're filling out on paper that go to the lab supervisor. The money received and the totals and reconciliation tabs. All right, so this is just a condensed look at the instructions. This is not, there's not detail here, that's all hidden, but there will be multiple lines for each tab that will explain to you how to use each tab. And I'll walk through those as well. All right, so this is what the participant form details and the volunteer form details tabs look like. And what you're going to do is just enter the last name and the first name. Some people will use the participant form number. You can use the participant form number for tracking. Up to you how you do that. And then you're going to use a 1 to mark the tests that this person purchased. Always use a 1, don't enter the amount because that will affect the totals. Enter the amount of the donation in column O, and then a formula will calculate the total owed in column P. And then you're going to enter the amount of their payment, cash, voucher, check, or credit card. If you're not matching, if the amount of the payment does not match the amount of the purchase, you'll get an error in this right-hand column. So make sure you enter everything very carefully. Same with the volunteer form tab, it's exactly the same, but it has the discounted prices here. So when it calculates totals, it's going to calculate everything with a 20% discount. So you're only going to enter information in the shaded cells. Everything else is protected and or uses formulas. Okay, the money received tab then. I'm skipping the add-ons and refunds because they look exactly like your forms. You're just going to enter the information into those tabs just like it looks on your forms, on your paper add-on and refund forms. So the money received tab, couple reminders to take out your starter cash before you start counting. And then enter refunds as negative numbers. So if you refunded a credit card purchase or a check, you're going to want to net out those amounts that you were returned. If you're recording the participant form, you need to record the payment and the refund. So the gray squares again are the ones that you'll be able to fill in. Again, you're gonna count by denomination for the cash, and the checks, enter the check amount and count how many of each amount there were. Same with the credit card receipts. And then you'll get a total up here for each payment type. The reconciliation tab is the last piece, and all of the data in this tab is carried over from the other tabs, so you're not going to enter any information here. It's all just displaying the totals that were brought over from the other tabs. So it's going to show you the total screenings that were purchased, the total donations, and the total monies that were received. Again, it's copying everything over, so you can't make any changes here. If it's out of balance, you'll see the difference highlighted in red. Okay, and you can see in this example on the left, somehow we took in $285 more than we sold. So probably we forgot to record some of the screenings, or we recorded some of the money incorrectly. So you're going to go back to those tabs and hunt and find the error. Once it's resolved, and in this case, it looks like we didn't record the screenings correctly because now we've gone back and added some screening amounts. And now we balance on the right. So you can see the screenings grand total equals the money's grand total, and your difference is 0. Sorry about that. So if it's green, it's good. If it's red, it's bad. You want to get to the point where you're balanced. If it's off, you know, sometimes errors happen. You have volunteer cashiers, and sometimes they record something incorrectly, or they transpose numbers or give the wrong amount of change or whatever. You need to just get as close as you can to balanced. If you're concerned about it, you can call the accountant and walk through it. Let the accountant know if it's big. If it's a big difference, a couple $100 is different from a couple dollars. So make sure you find as much as you can, clean it up as much as you can, and then you're going to email it back to the accountant. All right. Before you leave the fair, again, you're going to give the add-on and refund forms to the lab supervisor. That's the white copy. You're going to keep the yellow copies for your reconciliation. Clean up your cashier station, put away tables and chairs. Make sure you tidy up your area, throw out any trash, and leave it the way you found it. All right, let's move on then. When you return the materials back to us, you want to make sure all of the checks are endorsed. If you're a Metro site, you're going to make arrangements to bring the supplies and the money back to the health office, 365 health office, within 48 hours after your fair. So this may require some coordination with the accountant. And again, make sure the checks are endorsed, make sure all the money is secure because you're going to be bringing cash. Make sure that's secured in a sealed envelope inside your box of supplies. Okay, for statewide fairs, a little bit different. You're going to make sure all the checks are endorsed, but you're also going to take the cash to a local bank and purchase a cashier's check. Make it payable to 9 Health Services. And then if there's a fee for the cashier's check, take the fee out of the amount that they're going to convert to the check. You also want to make sure to endorse the back of the cashier's check and send it and the other checks and all of the supplies back to 365 Health within 2 days after the fair. You will receive a prepaid UPS label either in the box or it'll be emailed to you so that you can send that box back as soon as possible. Okay. All right, moving on, we're going to talk about the Square credit card terminals. These are new this year and they're pretty great. So glad to be done with the old credit card machines that we had. So we now accept all 4 major credit cards, also Apple Pay and Google Pay, and cash and checks. You'll have a little sign that looks like this to put on your table. Just helps people know that we're moving up in the world. We're getting new technology and making it easier for people to pay at the fairs. They're wireless and rechargeable. They're about as big as a smartphone and they're about as easy to use as a smartphone. We get immediate approval, so we don't have to deal with declined purchases. You enter each of the items that people are purchasing, so you get a double check of your math. When you have the math written on the form, when you enter it in the Square, it's going to make sure that you added it correctly on the form. Once you get the hang of it, these are pretty easy to use, and after you use them a couple times, you'll have the hang of it. You'll be able to go through a transaction pretty quickly. So it's going to save time in the long run. The Square terminals are used only for credit card transactions. They do have the ability to be used with a cash drawer, but we're not going to be doing that. Again, you need a Wi-Fi network connection. If you don't have a Wi-Fi available, you can use a cell phone hotspot. These really don't use a lot of data. So somebody can use this with their phone and they're not gonna run out of data on their plan. If you're concerned, ask someone else who might have unlimited data on their phone to use theirs. And I mentioned if you can't get on a cell phone hotspot or a Wi-Fi, it is possible to use these in offline mode. It's just like using the old credit card machines then, where it stores the transaction in the machine, and then once it's connected to a network, it will upload the transaction and approve it or decline it. So we really want to try as much as we can to be on a network during the fair so that we can get those approvals through right away. If it's declined, then they can use a different card, and we'll know that right away. So cards can be swiped, inserted, or tapped. And if people are using a phone app, they just hold their cell phone right next to the screen or above the screen. And it beeps. The approvals are very fast. Signatures are not required on receipts anymore. So that saves a little bit of time. And again, it's portable and rechargeable. You won't need to have it plugged in during your fair. So they're easy to move around the table. With the Square terminals, the participant makes the payment and selects the receipt option. So you set up the sale and then you give it to them and they complete the sale. And if you've used a Square at a store or a restaurant, you'll remember how that works, that you enter the sale and then they complete it. If you want to wipe down the terminal, please use a wipe. Don't use a spray cleaner. And again, remember, online registration refunds need to be done at the office, so you can't do them there on site. The touch screen is very sensitive, so be very, very careful and watch what you're doing. Double check everything before you total it. The screen times out after 5 minutes, and you can just pick it up or touch it and it'll come back on. So the night before the fair, you want to set up your terminals. And again, this can be done at the fair site or at your house. You want to take them out of the box, plug them in so they can charge overnight. Most likely when you receive it, it will already have been charged. You can charge it up then. The battery will last all day and then some. So you can see where the power port is on the left side towards the back of the device. And then you're going to turn it on, and you'll see where the power button there is on the front, on the left side towards the front. And you'll also see right below that arrow, that's the slot where people insert their card. There's a place along the right side of the device where you can swipe a card. When you're swiping a card, you put the magnetic stripe towards the device. Once you get connected to a Wi-Fi, and I recommend doing this the night before, get connected to the Wi-Fi at your home. It will most likely start a software update. These guys update software about once a week, and it takes about 20 minutes. So if you let it sit on the network, it will start the software update automatically. It may take a few minutes before it actually starts if it's got one that it needs to download and install. Please don't wait until the morning of the fair to do this because, like I said, these updates take 20 minutes, and you don't want to lose time in the morning before the start of the fair or at the start of the fair. So make sure that this is done before you get there or the night before if you're taking the machines to the fair for setup. Okay, so these screens will walk us through how to get connected to the network. And you'll see this is the home screen on the left. Number 1 is the home screen. And if you swipe up, just like you do on your phone, you'll see all of the tests listed down here. If you touch the green 9H, that'll get rid of all the blue lines, and it will only have the 9 health items to purchase. But to get on the network, you're going to touch more, which is the very lower right corner of the screen. And then you're going to swipe up. On the next screen, you're going to swipe up because settings is at the bottom of the list. You're going to touch settings. And then you're going to touch hardware. And then you're going to touch network. Now, I recommend that you have this printed out, these screens, and you have it with you when you're setting it up the night before and when you get to the fair and turn them on, because you're going to need to get on the network at the site. Keep these pages with you so you can walk through these screens. All right, once you're in the network list, you're going to select from the list which one you're connecting to. And you can see here, this device is already connected to a network called Z as in zebra. So just touch the line, and then it will ask you to enter the password if it's the first time you're connecting to that network. It will remember the password if you have to reconnect to a network. Okay, enter the password. You'll see the orange bar at the top. It says offline mode, swipe is available. And again, if you're not on a network, you're going to see that orange bar. That means it's still okay to take a purchase, to make a transaction. But we really don't recommend that because we cannot get approvals and declines instantaneously if you're not connected to the network. But if you're in offline mode and you're taking payments, you have to swipe the card. Again, the swipe slot is on the right-hand side of the device. All right, once you're connected to the network, you will go back to the home screen. To get to the home screen, on the very lower left corner is 4 little squares, and it says checkout. So you're always going to touch checkout to get back to the main menu. To make a purchase, then you're just going to touch the lines for each of the tests that they're purchasing. Just touch it once. If you touch it twice, you're gonna charge them for 2 of those. You're gonna swipe up just like you would on your phone to see the rest of the menu. And the volunteer prices are separate. They're already pre-programmed with the 20% discount, and those are down at the bottom of the list. So swipe up to find the volunteer prices. Once you've selected everything, again, you're going to ask for a donation. And if they're going to give a donation, you touch the donation line and you'll see that that price says variable. So that's going to bring up the touchpad. You're going to enter the amount of the donation on this keypad, and then you're going to touch add. That'll add it to your sale. You'll see at the bottom of the screen then the total number of items that they're purchasing. You're going to review the sale, double check everything by touching that blue bar. It's going to bring up a list of everything that was purchased, and you're just going to verify, double check it, and compare it to the form to make sure that it's exactly what the participant wanted to purchase. Once you're sure it's correct, you're going to touch charge. That blue bar. If there is an error and you need to remove something, you're going to just touch that item and swipe it left, and it'll remove it from the total. If you need to go back and add something, you just touch the black X at the top left corner, and that will take you back to this menu. So you can add additional tests that were missed, or you can add a donation and then review it again. And then if it looks right, touch charge, the blue bar at the bottom. Now you're going to hand the terminal to the participant. The screen turns black, and then they will confirm the total as well. So you're just going to turn the machine 180 degrees so that it's facing them. Leave it sitting on the table so that they can view it. They're going to double check, make sure that we charged everything correctly, and they're going to hit the blue bar that says confirm and pay. Then on the next screen, it will give them the option of how they want to pay. They can insert, tap, or swipe their card. Most cards now have the RFID chip, so they can tap it, and it's very quick if they just hold the card to the screen. They can touch it to the screen, and it will approve very quickly, and it'll beep. And this just shows you how they hold the phone up to the screen if they're going to use Apple Pay or Google Pay. All right, after their payment is approved, then they will get a screen that asks them how they want the receipt. They can have it emailed or texted to themselves, or we can print it for them, or they can say no receipt. If they want it emailed or texted, if they've used a Square in the past with that credit card, their information's already going to be in there. If not, they will have to type in their email address or their phone number. Don't do it for them. Just let them do that. It's quicker than trying to, have them tell it to you and then you enter it. Just have them do that. And then if they decide when they're done with that screen, it's going to say, it'll give them this screen that says hand the terminal back to the merchant. Please wait for your receipt. So when they hand it back to you, it looks like this screen. You're going to touch the button in the upper left corner that says print receipts. And that will print the paper receipt. And then the screen goes back to the checkout menu. If it's not on the checkout menu, touch checkout. Again, that's the lower left corner of the screen, little tiny 4 squares. It says checkout. All right, so you're done taking a credit card payment. I will show you how to print a second receipt for your cash box for your records. But we're going to look at how to do a refund. Okay, when you're on this main menu, you're going to select transactions, and that's at the very bottom of the screen, the second button from the left. It's an arrow two arrows going opposite directions and it says transactions. So touch that button or icon. And then in the list, you're going to select the transaction that you're going to refund. You can either swipe up through the list to find it. If it's a common amount, you can, you're not, unless you know exactly what time they checked out, it's going to be easier to just do a search. So in that search bar at the top of the screen, you're going to enter the last 4 digits of their card or the receipt ID. And if you look on their receipt, towards the bottom, it's going to have a receipt ID and it will be a 4-character code. You can see it on this, under the number 3 screen. You can see the receipt ID here for this particular transaction. But you can search on that. If you have their paper receipt, you can search on that 4-character code for the receipt. All right, then you're just going to select the one that you're going to refund. When it brings up the transaction, you're going to just touch Issue Refund. On the next screen, then you're going to select if they want everything refunded, you just select all items. Or if you want to refund individual items, you can do that as well. So select the items that they're going to be refunded and touch Next up in the right corner. It's always going to refund back to their card. Ignore the gift card line because that's not an option. You're always just going to select Canceled Order. We don't need any additional information from that because they're basically, all the same. We refunded for the test that they purchased. And then touch Refund in the upper right corner. All right. And then it'll say refunded. Touch Done when the refund is complete. And now you can, I recommend printing a new receipt. So I'll do that first. It tells you to go back to checkout, to go back to the main screen here on the bottom. But to print a new receipt, you can do that, or a copy of the receipt. You can do that from this screen. And it's just this second option here, New Receipt. That just means print a copy of the receipt. For a refund, you want a copy of that receipt for your drawer so you can make sure that you can balance everything out and you've got records of everything. And then again, back to the checkout screen. So once you've completed a transaction, you do need to print a copy of the receipt for your drawer. Do this immediately after the sale so you don't have to search through the list. If you hand them their receipt and then go straight into the list to print a receipt, it'll be the one that's at the very top of the list, be the one that you just did. So select that transaction and again, touch New Receipt. This is going to bring up this number 3 screen. You can see it gives you the option of doing a text or an email again, but you want to print a paper receipt for the drawer. So touch Paper Receipt and it'll print. And then always go back to your main menu. All right, at the end of the fair, when you're doing your reconciliation or when you're wrapping things up, there's a sales report that you can print. So go to More, which is the very bottom right corner. And then from there, remember we were in this screen when we looked at the settings to go to the network. But this time you're going to touch Reports. It's towards the top of the list. And then you're going to select Sales for the type of report. This is going to bring up, it always defaults to today and this device only. You want to change that. If you're doing this the day after the fair, you need to change it back to the day of the fair. If you touch this line right here where the date is, it'll bring a new window for you to change the date. You want to select all devices. Okay, I don't have that noted here, but remember to select all devices because then it'll combine the sales for all of the squares at your fair and print them all on one receipt. If you don't do that, then you have to print a report on each Square device and then add them together. Okay, so to print the report to paper, you're going to touch this, it looks like a share button on your phone or your tablet. But in this case, it means print it. You can email it, but that's what this arrow is for here. But you want to print it right out of the device. Excuse me. This will give you the gross sales and the amount of your refunds, and it'll give you net sales. Okay, so you want to, and this is showing on the screen, but then you're going to print it and it's going to give you this information on the screen as well. You'll see a number at the bottom that says fees, and you can disregard that number. That's the credit card fees that we pay to Square for processing these transactions. So it's not taken out of, you don't take it out of your sales or anything, just disregard that fee amount. You're just going to look at gross sales, refunds, and net sales. And all that is going to do is going to give you a way to double check what you've recorded in your reconciliations. All right, last thing is to replace the paper roll. It's a little hard to see to get the perspective of the box, but this is the device, and up at the top where the paper comes out, you're just going to push that little door with your thumb and it'll pop right open. You can take out the old roll and drop in a new one. You want the roll, the end of the roll facing you, so that it's coming under the bottom and then up towards you, so that when you tear it, you're tearing it towards yourself. Drop the new roll in, hold on to the end, close the cover, and then tear off the excess paper, and you're ready to go. Check your paper rolls before the start of your fair, and if it's down to a pretty small remainder of what's on the roll, go ahead and swap it out, start with a new roll so that you don't run out during the fair. All right. I can't ask if there are any questions because this is a recording. But if you have any questions at all, contact the accountant at 9Health, contact Alex or your site coordinator or Daniel, and you'll probably have their contact information at some point in this process of planning and executing the fair. And so good luck to you. I hope that you will have some great cashiers on your team. Be sure they watch the basic cashier training presentation. Be sure that you have a copy of this printed out with the screens for the Square, so you can walk through that with them, and so that you have that handy for when you're setting up your Square at home. And I want to thank you from the bottom of my heart for all of your help and your enthusiasm and your willingness to participate with us in our health fairs. We couldn't do it without you, and I mean that sincerely. Thank you so much. Thank you for your attention to this video and everything you do. Good luck.